Hi, I'm Brenna, a doctor of traditional Chinese medicine. I'm working as a registered acupuncturist in Canada. I'm also working as an instructor in an institute to teach students on subjects of medical herbology and Chinese-style massage. I came to Canada 4 years ago. Before I came here, I worked in a Chinese hospital for 6 years. I like my job to treat patients, to deliver knowledge to students. This channel is to share my experience regarding health. After staying at home for 3 months because COVID-19, the relaunch day is coming close. I'm looking forward to getting back to treating patients. All clinics are temporarily shut down on March 15th. My working place will relaunch on June 15th. The 3 months of quarantine is hard for everybody, including me. This is a long time, a tragic, grievous battle between all human beings and the virus. During these 3 months, I keep thinking about how we are supposed to do to strengthen our physiological status. The virus is keeping developing and changing. All types of the medicine are limited. It is impossible to cure all illness by using existing medical methods. Our body has a natural defensive system, the immune system. So what can we do to enhance the defensive system rather than consuming our energy and impairing our natural guard? Since I have worked in these 2 countries, I saw a lot of conditions and cases. So I'd love to share my experience and feelings about treating patients and teaching students. Following, I would like to share with you are the feelings I have and the events I heard from my relatives and ex-colleagues in China during the COVID breakout. Because of the high density of the population, at the beginning of the breakout, the virus spread very fast and wide. It was still in a period of the special time, the Spring Festival, a high volume of people migrating. So the speed of breakout already exceeded people's expectations. I was really worried about my parents and other family members during that moment because my parents already more than 60 years old and I'm the only child in my family. But I couldn't fly back to accompany them. So I call them almost every day. Fortunately, thanks to the strict management in local authorities and my parents' strong safety awareness of wearing masks and sanitizing hands frequently, they didn't contract the virus. The city where I came from shut down for 1 month. Most of the province in China shut down for 1 month. Only Wuhan, which had the most severe situation, shut down for 2 months. My parents told me people's life already getting back to normal after reopening all facilities in the city. But they are still required to wear masks when going outside. Take my hometown as an example because I lived there for 26 years. I know it best. The city I come from has 3 million inhabitants. The confirmed cases are 575. The recovered cases are 558. Deaths are 3. I often contact with my former colleagues in hospital during the special time. The figures issued by the government are authentic. All healthcare professionals are true heroes. Due to the shortage of personal protective equipment and the early stage of breakout, as soon as they put on all pieces of equipment, they cannot drink water, they cannot go to the bathroom 3 hours in a row. Because 1 doctor or 1 nurse only have 1 set of personal protective equipment every day. The doctors and the nurse should be given the biggest credit for containing the breakout. I also heard from my former colleagues that they use Western medicine combined with traditional Chinese medicine as a treatment protocol. It largely reduced the recurrence rate and the mortality rate. I believed that the other reason to contain the breakout is due to integrated treatment. I have strong faith in traditional Chinese medicine. I love it since I was a kid, and then chose it as my major when I entered the medical university, then worked as a TCM doctor after graduation. Even though after I came to Canada, I had a chance to change my career, but I felt so sad when I just thought about a change. So I insisted on the same career. When I worked in a Chinese hospital, I treated 40 to 50 patients every day. The treatment includes various types of acupuncture, herbal formula, moxibustion, cupping, scrape, injections on acupoints, tuina, and other modalities. I have to say, every day working in the hospital was fulfilling and so busy that feet were off the ground. This is the third year to teach TCM in Canada, around 100 students I have taught here. The question I like to ask students is, what is the reason that makes you decide to learn TCM? Almost 90% of students told me it is because they have been treated by acupuncture and herbal formula. They are stunned by the good effectiveness of those treatments. So they want to study and research how this treatment work. To be master under the TCM is extremely difficult for me, even though Chinese is my mother tongue, because it has thousands of history and took a lot of innovations during the long period. Some students struggled with it, feel frustrated about it. After crying, they could still renerve to get back to the classroom and continue to learn. I feel so proud of them. They need to have a strong faith that could support them to graduate from school. I often shared my experience with the students about how to study well in TCM. Let them know on the hard road of studying, I am always by their side. I also have a strong faith to support me continue to go on as a TCM doctor. I like to hear my patients tell me they feel better. I like to see the smile back on the patient's face. The most impressive patient I treat here is a female. She's only 28 years old. She's trying to be pregnant for 2 years. Her gynecologist diagnosed her premature ovarian failure. The chance to have a natural pregnancy is extremely low. When she came to the acupuncture treatment for the first time, she was crying and felt depressed. During the treatment, I also comfort her in spirit, enlighten her that don't push yourself so hard. We will do what we can do and let the universe to decide. What we can do is to keep optimistic, live in the moment. If you keep thinking about why I couldn't have a baby, there is only harm to your body, no goodness at all. In the following treatments, she told me she felt less stress, happier than before. After 4 times of treatment, her menstruation was getting regular. And in the 6 times of treatment, she told me she did a urination test at home. It is showing positive. She said she has tested thousands of times before, always show negative. This is the first time showing positive. Her treatment was 1 time a week. One day evening, before the nice time of treatment, she sent me a message said, "Good evening, guess what? I am pregnant, just found out." I can feel from the message how happy she was. I was the first person she told. She was so excited and grateful. I am happy for her from my deep heart. No more treatment afterward. She is stable and will become a mother. Some patients said, I don't only treat them physically, but also treat them psychologically. It is true, because in TCM theory, The spirit is closely related to the physical health. Excessive emotional change is one of the pathogens to cause disease. I often remind myself and recommend my patients that keep a good mood, live in the moment. I also treat the menopause syndromes. One patient I remember, her symptoms were severe: hot flash, light sweating, and spontaneous sweating. Sometimes she has to get up to change wet clothes during the night. She also had poor sleep and aging spots on her face. To relieve all her symptoms, I treated her by 4 times of acupuncture and a bottle of the herbal formula. She is getting much better now. Less sweating, less facial spots, better sleep. During the quarantine period, she sent me her photo and told me her facial dark spots fade, and she wants to have more herbal formula. I can tell from her photo she is happy with the result. But the clinic is closed right now, so she only could get the formula after reopening the clinic. Okay, that is all I shared today. If you have any question or topics that you are interested in, please leave the message in the comments. I will try my best to answer your questions. Have a good day.